What problems does rhinoplasty correct? Rhinoplasty, or what's commonly known as a nose job, is done to correct a variety of problems. Many people have really just problems with breathing, and if that's the case, a rhinoplasty can be done to straighten the septum, which is that cartilage plate that's between the two sides of the nose on the inside. A lot of people have what's called a deviated septum, which is a pretty commonly known term. And what that means is that that cartilage plate is pushed over to one side or the other, and it can block the airflow through that side. There are also structures that are called turbinates, which are used to humidify the air as it goes in. And it also warms the air as it passes over those structures into the lungs. For a lot of people, those turbinates are overgrown and can cause a blockage of the airway. People who need to have rhinoplasty in order to correct a breathing problem pretty much always will require a correction of the septum in order to straighten it and to reduce the size of those turbinates so that it can improve airflow through the nose. Because a lot of people don't like something or other about the way their nose looks, when they have an operation to correct breathing, other things can be done at the same time in order to make the nose look nicer. And that can range from making the tip cartilages more refined, straightening the nose, reducing what's called a dorsal hump, which is what a lot of people just know as a big bump on the nose, reducing the overall size of the nose. There are many, many things that can be done at the same time. The best way to approach rhinoplasty is to do everything that's necessary at one operation. Rhinoplasty is one of those procedures that when it has to be done a second or a third time, becomes much more difficult to do and to produce a natural result. The tissues in the nose are very refined, thin skin, small cartilages, and when they've been traumatized more than once, it becomes very difficult to make them have a normal, natural shape. So if you are considering having nasal surgery, whether it's for breathing or for appearance, be sure you're seeing somebody who has a lot of experience doing rhinoplasty and can do everything at one sitting. I see a lot of people who initially come in because they don't like something about their breathing, then happen to mention they don't like the way that something looks. Many of those patients have been told by another surgeon, well, we can just fix the airway problem, and then if you decide you want to do something with the way that it looks, you can do that later on. My approach is always to do everything at one time, and so I will talk to people about if there's something that you don't like about the way it looks, this is the time to do it. If you have just one operation, you can make everything better, breathing is better, the appearance is better, and you won't have the types of long-term issues with scarring and the shape changing that you might have if you have to have multiple operations. So be sure to see somebody who's experienced. I have a lot of experience doing rhinoplasties, and that ranges from people who want it made smaller, people who want just the tip to be more refined, or somebody who just has a problem with breathing. This is Dr. Kutty. Please give us a call at Luxe Plastic Surgery. Our number is 281-313-0551.